Today we're talking about pancreatitis, which is inflammation of the pancreas, or also an autodigestion of the pancreas resulting from long-term damage. Now, generally, the typical causes are alcohol abuse, gallbladder disease, obstruction of the ducts, hyperlipidemia, or peptic ulcer disease. And we have two different types that we're going to see. The first would be acute, where it occurs suddenly, with most clients recovering fully, or chronic, usually due to long-standing alcohol abuse with loss of pancreatic function. All right, let's talk about assessment. For our pancreatitis patients, we're going to see abdominal pain with sudden onset, located in the mid-epigastric and left upper quadrant. Nausea and vomiting are common. We may see weight loss because of malabsorption, abdominal tenderness, and abnormal labs, an elevated white blood cell, bilirubin, ALP, amylase, and lipase. Cullen's sign, which is bruising and edema around the umbilicus. Turner's sign, which is flank bruising. This is indicative of pancreatic autodigestion or retroperitoneal hemorrhage. And lastly, steatorrhea, which is fatty, foul-smelling stools. The therapeutic management for pancreatitis is firstly to suppress pancreatic secretions through an NPO diet and NG tube insertion to decompress the stomach. We're going to make sure these patients get IV hydration, TPN for prolonged exacerbations to make sure these patients get adequate nutrition, endoscopic retrograde cholangiopancreatography, or ERCP, to remove gallstones, where a camera is inserted to visualize the common bile duct. Fifth might be surgery. There's a procedure called the Whipple, where we remove a portion of the pancreas for cases where there's a mass or a tumor. A pancreatectomy, where we remove the pancreas. This is going to require insulin, glucagon, and pancreatic enzyme supplementation. And cholecystectomy, if the source is gallbladder disease. And the last therapeutic management would be some medications for pain to control symptoms like analgesics, H2 blockers, proton pump inhibitors, insulin, and anticholinergics. So again, we are talking about pancreatitis, which is an inflammation of the pancreas. An autodigestion of the pancreas results from long-term damage. Thanks, guys. This has been another episode of NCLEX Flash Notes podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's NCLEXbook, NCLEXBOOK.com. Happy nursing!